And we're live.
And we
Hello,
are.
everybody.
Hey, happy Sunday.
Happy
Hello.
Sunday.
How's everyone doing?
I'm good. I can't complain. How about you guys?
Pretty good.
Yep, doing well.
No room for complaints either.
None at all.
Mm-mm.
So, this weather, even though it's kind of cloudy today, um, I still enjoy like the 75-degree weather. I don't really like when it gets super hot.
Me either. Me
How
either.
about you, Iyantta?
Yeah, no, I agree. If the humidity's down, I'm good. I don't know if it's going to rain later or not, but
I
I'm
know.
good. I can breathe in this weather, so I would agree with that.
Are you here, Ayanta?
Yep.
You here?
Yes,
Okay.
I'm local.
Okay.
Let's see. Local. Everybody's local.
Yeah.
So, Tanya,
Yes,
what are we
ma'am.
talking about today?
Oh my goodness, we're talking about dealing with grief and loss. But before we go there, I just want to, Keela, you're so modest, but I do need you to hold up that thing that's right beside you, please. And
Oh,
let's
okay.
talk about
Because
that.
we talked about this off the grid. I am a little modest. But
I know.
listen, guys, I'm
We're
so
crowning
excited.
God's daughters, an anthology.
Yes,
So flip that over on the back and point. And if you look the bottom
there
row
I
right there, there's Keela. She co-authored this book. And,
Congratulations.
am.
and
Thank you. I'm so excited about this too.
why? Tell us about it.
I'm so excited because sometimes you live with so many things on the inside. A lot of people don't really know you like, you think they do. So I got to tell a little bit of one testimony in this book that and it's basically based on forgiveness, but it's about forgiving yourself basically.
Mm.
So I was really I pulled this story back twice because I was like, I don't know if I want this out there like that. But at the same time, I also had heard a message was basically saying, you know, someone said to me, where you're going, you want to tell all that needs to be told before you get there. So
Mm.
nobody can tell it on you.
Mm.
So
Okay.
when they said that, I'm like, oh, that's kind of smart because they were like, people will dig. So it's an encouraging story. It's but I'm just glad to kind of get that out. I feel like a weight have lifted off my shoulder.
Yeah,
Yeah.
Yeah, that's
So
quite an accomplishment. Congratulations.
it
thank
is.
you,
I'm excited for you.
Yep,
thank
I've
you.
ordered me a copy. So
Yes, and I've
Yeah.
got yours. Be out tomorrow.
awesome.
Yes. I need to get mine as well. And we need to make plans to have you and your co-authors on the show.
Yes, let's do that.
Because
Yeah,
yeah,
we should do that.
because it's so unselfish for you all to tell your story because it wasn't just for you.
No,
It's for to help others. So
it
we got
wasn't.
to get it out there.
And some of the other lady stories, like when we were going over the editing, and obviously I only read my story because she sent us the whole book, and I'm not gonna lie, I'm like, okay, I'm just going through mine, make sure stuff is right. But I got to sit down and read some of the other ladies' stories since I got the book, and I'm like, wow, some of these ladies is powerful, powerful, powerful testimonies.
Wow. Whew. Ready for it. Ready to hear it.
Thank you.
Ready to hear it.
So
Go ahead.
let's get the show on the road.
Yes, let's do it. Let's do it.
Because as Tabitha Brown would say, come on into the room, because y'all know I love me some Tab Brown, so
Uh-huh.
I'm gonna always quote her and put her name behind it so we don't get sued.
She's
So
awesome.
She probably wouldn't do it anyway.
she probably wouldn't, but I still want to give her
People
her
may.
credit because that's how much I love and respect
Yeah.
her.
Yeah.
That's how much I love and respect her. So, with that being said, we're going to welcome Dr. Iyantta Howell, even though she
Yes.
told us to call her Iyantta. I've counted such an honor and a privilege to see one of our own have the doctor in the front of it. That's a beautiful thing.
Mhm.
That's a big accomplishment.
And another modest person too, because you earned that doctor.
No.
And it's just like, Yanta, how? I would be like, doctor.
listen. What's so funny about that is she became a doctor, right? And then you have people who just be a pastor, be like, "Oh, it's pastor to you."
Uh-huh.
You like, okay, wait, okay, I'm sorry.
Well,
But
I appreciate the kind words, but it was not an easy road
I can
at all.
imagine.
God helped me along the way. I mean, I did put forth the effort, but it's the experience was humbling just to even go through medical school and just, plans did not go according to how I thought. And, my timeline was just all thrown off. But, I made it and learned a lot of things along the way. So if I can help someone, which is, what you did, Keela, in your book and all the other authors, I think that's what we're on this earth to do. It's not about
Exactly.
titles. It's, are you doing the work of what you say you are? So, but thank you for the accolades. I do appreciate that.
And that's
Yes.
what I like. And that's the one thing about those timelines, because all of us have that outline that we want to strategically follow. And the path is never like this. It's always just
Yeah,
It
for
is.
sure.
And I'm seeing like the what is the Roman numerals, then you have like the sub, and then you have the sub, and you have the sub. That's
right.
kind of how it goes. And
Pretty
then,
Yeah.
much.
and for every A, it has to be a B. For every one, it has to be a 2.
Oh gosh, it's all over the place. But
All
at the end
over.
of the day, when you are following your calling, you're going to get there and you're going to touch the people you are supposed to touch. So
Yes.
today we are going to be talking about dealing with loss, grief and loss and grief. And I thought, it's funny because we actually scheduled this show with Iyantta a while back. So considering that I just recently lost my uncle, I thought, what's the odds that this would be the podcast that's right behind that? And
Mhm.
I'm really kind of looking forward to the podcast. It's been a hard road. So with that being said, ladies, where are we going today?
We are
We are
going
going
all the
all
way
the way there.
there.
All
All
the
the way
way there. All the way there.
Where are we going today? All the way there. Let's go.
So, everyone, first, I would like to say that Ayanta and I went to school together. So, high school together. So, it's an honor and privilege to have one of the Mumford Mustangs on the show, because Tanya loved to always talk about Cass, but today it's about Mumford.
I got my green today.
Today is about the Mumford Mustang. So, Ayanta, we would love for you to tell us a little bit about yourself.
Yeah, well, as you said, I graduated from the great Mumford High School, educated in the Detroit public school systems. And after that, after high school, I went on to University of Michigan for my undergraduate degree. And then I came back to Detroit for my medical school training, which was at Wayne State University. And I also did my adult psychiatry residency there.
Okay.
And then I went to the University of Pennsylvania to do my child and adolescent psychiatry fellowship. So I was out there for a few years, came back. So I work with all age groups. My passion really is working with kids and teenagers, but adults, kids and teenagers eventually become adults. So a lot of the work is similar, a lot of it's different, but for the most part, people need that support. So I'm happy to be able to serve my patients and their families. And I really like to educate people on, the symptoms that they're experiencing, the origins, because I think a lot of the distress that patients feel is because they don't understand really what's going on with them, and that, a lot of people experience it. So I think empowering them with, that psychoeducation and the information to let them know more about themselves really in and of itself is very therapeutic. So my job is very rewarding in that way, and I really enjoy what I do.
I love it. I love it.
So you said psychiatry?
Yes.
Nice. Do you know Dr. Xavier White?
That name sounds familiar. What school, What year did they come out of?
Well, he's much older than us, but he's been in psychiatry for many, many years. Because I didn't think there were that many, Black people, African Americans in psychiatry in metro area. So yeah.
Okay, no, I don't. That name sounds familiar, but no, I've never met Dr. White.
Okay.
Well, congratulations on all your accolades. That's awesome.
I know, that is awesome.
God be the glory.
Yeah.
So we're gonna get started because it's been a lot of stuff going on in the USA. I mean, other countries as well. Every single day there has been some type of shooting, mass shooting, for over the past week now.
Mm-hmm.
And I don't want to get to a point where you become what's the word I'm looking for, Tanya?
Desensitized.
Yes. I don't want to become desensitized to it. Like someone said previously, it's time for us to get past the thoughts and prayers type of thing. What can we do to change some things? But even behind all of that, behind the computers and everything, people still, you sense the loss, even with people that you don't know. And everything has become everything is recorded now. So you are actually seeing not just the movies, real people getting shot. And it's just like, boy, you don't realize how much of a load you can carry just about watching this stuff day in and day out. And sometimes I have to tune out, check out of social media a little bit. And I may be on replying to people on my posts, but sometimes I'm trying not to scroll because it's always something so negative to see. And it can really weigh on you. And, you can carry a heavy burden. So basically, the first thing we wanted to talk about, which everybody can pretty much summarize what grief is, but I answer exactly what is grief, because I know people are like, well, I was crying yesterday, but what exactly is grief?
Yeah, no, that's a great question. So grief really in a nutshell is just an emotional or distressing reaction to a loss. And kind of the prototypical idea is, a person may have lost a loved one and you kind of envision someone sitting in a dark room crying with the covers over their head. They're not leaving the house. That's one image, but there's so many different types of losses. You can lose a job, you can lose a pet, you can have a similar reaction to that. With COVID-19, a lot of people lost their lives. Not just in 2020, but people are still dying from COVID, And initially when the pandemic first hit, you had really a complicated grief process because a lot of times you couldn't even contact the dying loved one, right? You couldn't go to the hospital, you really couldn't comfort them if you had something you wanted to say to them.
Oh God, I can't imagine that.
Yeah. So it's just, it just made a horrible situation that much more horrible, right? And then you had the situation where a lot of people couldn't really have funerals. Where they couldn't gather. So you didn't really have the ceremonial end of life events that really helped to process grief. So, you had that. And then the people who thankfully survived COVID, a lot of them have what they call the long haul COVID, right? They have symptoms that just aren't going away. They have physical symptoms, but then they also have the mental health issues, the cognitive clouding. They don't have good concentration. Some of them couldn't even continue to work because they were just so disoriented, and that didn't get better. So it was just a loss of a sense of health, safety. There were so many losses, loss of relationships, romantic relationships. It's just
losses,
weird, right? Because the pandemic happened doesn't mean that we still didn't have the everyday normal losses of, severe illness, divorces, breakups. You name it, right? So, yeah.
That's grief. So I know that you just explained the different types of grief and how people can grieve. But do you think, and I'm asking this question for myself, because you and I talked on the phone interview and I thought the second word you used was pretty good. So a lot of people always say, I'm coping. So is there a difference from people coping Is coping actually a thing, and or are they just coasting? So what is the
Right.
difference with that?
No, that's a good question. So, in the world of psychology, psychiatry, when we have distressing emotions or when we have loss, trauma, it's natural for us to find ways to try to comfort ourselves, soothe ourselves, distract ourselves. So, like I said, in the world of psychiatry, we call that coping skills or
Okay.
coping skills. So there's two types. You have your positive or healthy coping skills, or what we call adaptive coping skills, and then you
Mhm.
have your negative or maladaptive coping skills.
Mhm.
So we all find ways to cope. The question is this sustainable, what I'm doing? Is this going to cause me more problems in the long run versus is this something that will actually help support me and help me in my grief process?
Okay.
So when you say coasting, I know what you mean by that, but you really you can't take that approach when it comes to grief because
Mhm.
you really have to be intentional and aware of what's happening when you're grieving. If you just let the emotions kind of take you there, so to speak, it will
Mhm.
take you everywhere, right? So you really can't coast. I mean, a lot of people do,
Mhm.
but they end up in patterns of addiction. They may lose jobs because they're not really perhaps getting therapy like they need to, so they just don't have the energy or motivation to get out of bed in the morning. Um, so yeah, I would say coasting would really put you at risk for falling into what we call a complicated grief process, which can lead to a
Mm.
mental health disorder, as
Mm.
well as a lot of other issues. So some people probably think they can coast, but you really need to seek help if you are grieving, if you've had losses, trauma, those types of things.
Mm.
Would you say coasting and being on autopilot is the same?
Yeah, I think, yep, I would, in my mind, anyways, I would say that. But I think the misnomer there or the misconception is that people feel like they are coasting or that they are on autopilot, when actually your body is reacting to the grief, right? So
Mhm.
you have the emotional reaction, but you also have the physical reaction. And a good example of that was the Uvalde shootings. The one teacher who unfortunately was shot and killed, her husband actually died a couple days short of that.
Mhm.
I heard that he died of a heart attack, but there is a syndrome that also affects the heart after a person experiences like a traumatic loss.
Mhm.
It's called broken heart syndrome,
Mhm.
right? And that's actually a medical syndrome that happens where the heart muscles are actually weakened, and a person can actually die from that. So if you feel like you can coast or go on autopilot, that's going to be a problem because your body is going to be reacting to that loss, right?
Right.
So we try to swallow our emotions and just kind of white knuckle it. Your body probably will stop you. Now, a lot of people won't have such severe symptoms, but you can expect to have maybe non-specific, less severe symptoms such as headache, stomach ache, um, poor concentration, those types of things. So even though a person may feel like they're on autopilot, they really are doing themselves a disservice by kind of ignoring the loss or the magnitude of that loss.
Mhm. So, like, even with coping, you said there can be some healthy skills and some non-healthy skills.
Absolutely.
So, like, get weight gain, because I know sometime when you're grieving, you turn to certain things. Well, I'm speaking for myself, y'all. I don't know about y'all, but I know
Yeah. Mhm.
I some people lose weight. I turn to, and then I don't really realize it. So I'm like, okay, I need to snap back before it gets out of control. Let me get myself together. And I think Crystal said, I love music very, very much since being a small child. I listen every day and I posted more music on Facebook page. Music soothes my soul. Yes, I'm a music person too. And I'm very selective about the music I listen to when I know that I'm dealing with something. Like there
Mhm.
are some songs I just can't listen to when I know I'm not in a good state of mind. And I know some people will gravitate to those songs. I run from them because I don't want to be like Alice in the Wonderland going the rabbit in the hole. Right?
Yeah. Mhm.
So Tanya, did you want to read that other question?
Yeah, yeah. So I'll just, in a nutshell, she's basically saying this is Miss Graham, Kayla's mom, Doris. Is there a limit to grief? How long you may grieve? Because how long should you grieve? Is that a true statement? Like every person grieves at a different amount of time.
Right. Yeah, every person grieves differently. And, the timeline for the grief varies depending on pre-existing conditions. If you have a pre-existing mental health issue, maybe that's not properly addressed. That can certainly prolong the grief process. But in general, you can never say how long is too long to grieve. Mm-hmm. However, there is a mental health disorder called persistent complex bereavement disorder, which is when a person is just stuck in that loss and all they can think about is their loved one's death, how that person died. They may want to join that deceased person. They're not, fulfilling their obligations of work, school, and they're just really stuck. That is abnormal. Mm-hmm. Even if that goes on for a few weeks or months, because with normal grief, really your pain should ease up after some weeks or even months. Like you should experience some relief, mm-hmm. right? Mm-hmm. Because grief comes in waves. So while there are no timelines on grief, you should expect to feel somewhat better as time goes on, mm-hmm. And someone else asked about, are there stages of grief? Actually, that's my aunt.
Hey, Auntie.
Hi.
Yeah, that's my aunt. So, do you guys want me to answer? I guess.
Actually, because that was one of the questions. So,
yes, absolutely. So it kind of ties into what I was talking about. So, there was a Swiss American psychiatrist by the name of Elizabeth Kubler-Ross. You guys have probably heard of her, mm-hmm. but she's kind of considered a pioneer in kind of end of life issues. So she did a lot of research on grief and loss, and she basically wrote this book called On Death and Dying back in the 60s, and it was a hit because a lot of people kind of didn't understand what grief was. But most of her research at that time dealt with people who were at the end of life. Like she did a lot of research and worked with people who had terminal illnesses, basically cancer. Okay. And she found that these patients kind of went through 5 common stages of grief. And she talked about it in her book. But so there are 5 stages. The first one is denial. So mm-hmm. denial. So denial is basically just that. Like it's a person, maybe they're in shock. They can't believe, in this case, the diagnosis of cancer, right? It's a shock mm-hmm. to the system. I'm going to die. Mm-hmm. So that's the first one. The second one is anger. Mm-hmm. You can imagine getting a diagnosis such as cancer. You're angry, you're frustrated. There's really nothing you can do to change it, but you're just angry because this is not news that you want to hear, right? And then there's bargaining. So this particular stage, as it relates to patients who are kind of on their deathbeds, they will pray or bargain with God or whoever they feel is their higher power and say things like, if you heal me, then I'll maybe step on to church more, or I'll do this or that. So it's, they're trying to negotiate and get out of a situation that really is unchangeable. And then you have the stage of depression where the person mm-hmm. intense sense of sadness. Now, this is not major depression or this is not clinical depression, but it's just a depression as it relates to this illness. And really, you're having problems coping with it. And then the last stage is acceptance, where, some of the pain eases because you've kind of accepted the fact that I'm going to die and it's really nothing that I can do about it. So she described those different stages, but she was very clear in saying that not everyone experiences every stage and it does not go in that particular order. Mm-hmm. So those are kind of considered the main stages of grief. And a lot of researchers kind of took her work and found that you can actually apply a lot of these different stages to other losses that we may have mm-hmm. that really involve losing a loved one or death, right? Mm-hmm. So those are pretty much the different stages of grief.
It's the different stages. I could honestly say that I went through those stages when I got divorced. I went through those stages when I lost a loved one. So I could see all of that in both situations. So, and they're both experiencing loss, but yeah, definitely the anger, just finally accepting it, just the denial part, and guilt. I don't know if that fall under, but I had a lot of guilt of what I should have did, what I could have did, what I didn't do, So yeah, that's interesting.
Yeah.
So, Mom, she pretty much answered your question. She said it's depression, a form of grief, which you already answered. So, what do you say to the person? Because I know everybody have had this person. Get over it.
Mm-hmm.
Get over it. Because sometimes when you're grieving, everybody does grieve differently, and some people, their snapback is real, and then some people, they carry that away with them and it makes them feel worse.
Right.
So
Yeah, I mean, if you're having someone that's literally saying to you, get over it, I would say don't say anything to that person. I would take their comment as a gift for me to know that this is not a person that I should continue to spend time with, or I should really limit the amount of time that I spend with them. I shouldn't be sharing with them my deep emotions and what I'm going through, because this is not as what we consider a safe person, right? So if someone would say to you, get over it, I mean, that's very callous and very uncaring. So I wouldn't engage in a conversation with that person. I would just really try to seek out supports that really understand that grief is a process, that it takes time, and that it's something to be taken seriously.
I could kind of understand, moving on from someone that doesn't quite understand. But I can remember when I was going through something and someone allowed me that time to roll on the floor, cry, whatever. And then at some point it was like, okay, get up now. What's next? And it wasn't that this person was trying to tell me that I didn't have the right to feel that way. It was just like, feel that way now, but come on, let's
move forward.
Let's move forward. Let's see what we're going to do about it. And if we have to circle back to that, then at least we know now where you could go after you finish rolling around and crying.
Absolutely.
So
yeah, no, I think that's important. When you're in grief, you really are not able to pull yourself out of it. So if you have someone who recognizes that, can come in you and offer you resources and say, hey, you know what, I see that you're struggling, let's really do something else to support you, then yeah, that definitely is appropriate. But to just say get over it and you're not helping that person.
Yeah. Right. And I think, to me, those are what healthy friendships, relationships, people do for you. Because even in the book, okay, that wasn't a plug, I'm just saying, I talk about a friend who basically, when I was grieving, who was like, okay, listen, on my watch, you're not about to be stuck here. So let's start sending me scriptures. This is what you're gonna do. And at first, I was, you remember Tanya when you and I tell this story all the time. I got so mad at Tanya because she called some people, but she was helping me. Later I realized she was a friend that was actually helping me. Like, okay, look, I'm not gonna let you stay in this situation, and I'm gonna start putting people on notice about this situation. And I think, to me, those are the people, like you say, the ones that say get over it, you stay away from them. And I love how you put that. They are not not in that safe place. That's perfectly stated the way that you said that. I like that. Okay. So why is it important to acknowledge and understand your grief, and anybody else that you may be around, to understand them too? Because sometimes when people are grieving, it can be hard on others, depending on what stages they're at. So why?
No, absolutely. I totally agree with that, which is why, people in the profession that I'm in, they went to school for that, right? That's a heavy load to put on a lay person, like a friend or relative, to bring that grief to them and how you're feeling. Certainly is important to do, because these are people who know you best and they love you. But after a while, that's heavy, because they may also be dealing with that same loss if it involves the person that they also loved. So this is why mental health professionals train to do what they do. They're there to support you, right? It's almost like if you fell in the middle of the street and you broke your ankle, and then, you know, your mom brings you into the house and you're expecting her to cook for you and drive you, like, you know, that's okay for a while, but probably you should go and get a cast.
Right.
That is a good analogy, Iyantta. I like that.
So I think sometimes we do put extra pressure on family members, not really realizing that we are in a state of severe emotional distress and we need professional help. So it's always important to get that professional help. So that's one thing. And then you also said, why is it important to understand grief? Well, I think understanding grief really is understanding yourself, understanding, you know, how I react to losses. That, like I said before, that this is normal. I may feel like what I'm feeling is abnormal, but to get in spaces with people who understand what I'm going through, that can really be therapeutic and help to lift you out of that hole, you know? So that's why it's important to really understand that, so that you're not feeling down on yourself. You mentioned guilt before. Sometimes you can, because you don't understand that, wow, I can't get out of bed. I feel guilty. I'm lazy, right? But really, when you have certain traumas, it actually changes the brain chemistry. There have been a lot of studies that find that you can have lower levels of hormones that help you to get motivated and even get out of bed. And this is what happens with depression. And sometimes grief can turn into depression if it's not done properly. I mean, there's no proper way to grieve, but sometimes we can be struggling with a medical issue, thinking that it's just something we can just kind of snap out of.
That's interesting.
And then Stephanie, hi, Stephanie. Stephanie had a question that kind of related to what you were saying, Keila. And it says, what do you say to the person who gets past it, but there are still triggers that bring back the pain at times? You know, I'm not a counselor. My job is basically medication management, and but I work with counselors. For instance, if I have a patient who just, you know, they have a tremendous loss, and if they fall into depression and they're not getting better with counseling or therapy alone, that therapist will refer that patient to me, and I may prescribe a medication, and that kind of helps them for the patients that need that. So when I see patients who are still triggered, what I try to do in the limited amount of time that I have with my patients is I try to listen. I mean, what can you really say to someone? If the pain is being triggered, I think the best response is to listen, especially if you've never experienced that particular pain, right?
Right.
And I think for people who have experienced great loss, which Stephanie, I know that you definitely did.
Great loss.
I think really maybe having some really supportive people around you, even a therapist on standby, knowing that although you have gotten far from that grief, that you will still have triggers and you will still have reminders, and that's completely normal because this person was extremely important to you. That person will never go away, even though they're not physically with you. Understanding that, having realistic expectations about the grief process, and knowing that even if you do grieve properly, you're still going to have those triggers and reminders.
Definitely. Tanya, were you about to say something?
No, I was just thinking in regards to the death of my father. I was 9, but the one thing I remember is that he smoked cigar in a pipe. So that would be a trigger for me. But just recently, over the last couple of years, I just bought candles, and whenever I feel like I want to remember my dad, I just burn that candle that smells like a pipe, and it's soothing. So, yeah,
that's great.
I have little things that I do, you know, for my, like, you know, birthdays were really big for him. So I always make sure that I'm going all out for my birthday, you know, whatever, because that was a thing that he loved to do. And so the first birthday, which literally was 2 weeks before my birthday, he passed. It was so hard for me because I'm like, okay, it's the first birthday without him. But my cousins and them made me go out. They were like, okay, we're going to go out. Let's do this or whatever. And then from that point on, I was like, you know, I'm going to celebrate my birthday. And I never was a person that wanted to, you know, rah, rah, rah. Well, with him personally, but not with, you know, a collective of certain friends, because I'm very strategic even with that. But yeah, I can agree with you, Tanya, because those things kind of put it back into its perspective of who they were, or that good memory, you know.
Yeah.
That's pretty good, Tanya. Literally your panel asked all the questions that we had. So we're gonna go. If anybody in in the comments have any other questions, I would love for you to ask them while we have her for the next 20 minutes. Because this is really it's been just so much going on. What were you getting ready to say, Tanya?
No, I just do. So I'm looking over like the 5 stages of grief, Iyantta, and I'm wondering, like, if you stay stuck at one for too long, like let's say you just stay stuck at denial, that could like hinder your progress, grieving period. Like how bad. So you look at denial, anger, bargaining, depression, acceptance. Is there one that's like that can have more of a negative effect if you stay stuck on it? You know what I'm trying to ask?
No, absolutely. Yeah. I mean, all of them can, anger, imagine what it can do just to your body if you just stayed angry. Forget grief, right? Prolonged anger has been known to increase blood pressure, cause heart disease, all those things. Denial, that definitely is a problem. Bargaining, depression. So basically, if you stay in any one of these stages too long, and it's almost like, well, what is too long, right? But if staying in any of these stages results in your inability to function like you normally function, meaning you're not, meeting your obligations, maybe you're not going to school, you're isolating, you're not going to work, your bills are piling up, you're not really spending time with people, you're not taking care of your kids, you're just kind of back there in the room, always, just by yourself. That is a problem. And like I said, that can very quickly tip you over into a major depressive disorder. So that's one of the things there. And not to be too controversial, but these 5 stages of grief, like I said, does not just apply to I lost someone, right? Really just I lost something that was important to me, whether that's a person or a job but even I think back to kind of COVID-19 when we first, the pandemic hit in early 2020, how there were so many people who didn't want to stay home. There were so many people who didn't want to wear masks. There were so many people who they had a hard time coping. And a lot of that was really their grief. They were in denial, right? Remember when they lifted those bans on the stay-at-home orders and people were so quick to just crowd out those bars and just acting like there was nothing going on, despite thousands upon thousands upon thousands of people dying.
Denial.
Yeah, that was actually a form of denial. And then some people you approach about it, they get angry. Think about all of those altercations in the stores where, people tell you wear your mask and they're like, I'm not wearing my mask, and they would fight. And that was a grieving process. I'm grieving the loss of normalcy, right? This was so overwhelming to everyone.
It was.
Even the people who didn't even want to acknowledge the pandemic was an issue. It was an issue for them. It was a grieving process, right?
That's interesting. Because it was a lot. And it was a lot abruptly,
Absolutely.
So that's interesting.
Yeah.
So and Tanya mentioned, go ahead, Tanya.
Oh, no, go ahead. No, it's okay.
Yeah, you mentioned about the candle burning and how that really was comforting for you and losing your dad. So I think that is important for us to talk about, like positive coping, negative coping. I would say that that's a positive coping skill. That's an adaptive coping skill that's not going to cause you any harm in the long term. And that's something that you do to soothe yourself that is actually very, very supportive to you. Now, oftentimes I will see patients, or my colleagues who are therapists will see patients who really have indulged in really some maladaptive or negative coping skills. I mentioned a few of them earlier. Substance use, right? Alcohol. And I want to go back to the pubs, right? The pubs that were crowded out in COVID-19. It wasn't like they were crowding out movie theaters, right?
Right. The bars.
Places where they can get medication, right? Self-medication. Let me get this alcohol because it's helping me to cope, right? So alcohol is known as the a CNS, a central nervous system depressant. A lot of people who have anxiety are known to gravitate towards alcohol. That's a well-known fact. So a lot of people, whether it had to do with COVID-19 or not, but a lot of people will negatively cope with substances, alcohol, marijuana. With marijuana now being legal, it's no wonder why we smell it wherever we go.
Everywhere.
Right?
Everywhere.
Yeah.
People you wouldn't even think that you'll smell it on.
Yep. So it's like, okay, now I have an outlet to help with my anxiety, because marijuana and alcohol have that in common, where people who are very anxious, they gravitate towards those two substances. So to me, that's indicative of a lot of people who have unresolved trauma and anxiety, because they gravitate toward alcohol, marijuana, other substances. You mentioned weight gain. Some people gravitate toward eating excessively. Some people sleep excessively. Some people engage in kind of indiscriminate sex. They rebound relationships, anything to kind of distract me. Some people are scrolling social media. Some people even will do things that appear good or positive, but really aren't. One thing is over spiritualizing kind of our issues, right? You're trying to apply a spiritual intervention to something that's actually medical, right? And that goes into kind of the whole issue of counseling and medications if needed. You can pray, but prayer is active, right? Faith without works is dead. So while you're praying, get in the car, go down to your local counseling center and get some help, right? Because sometimes that can keep a person stuck. Well, I'm just going to pray about it. I'm going to read my Bible. And those things are good things, but especially in the Christian faith, praying and reading your Bible, all those things are active. You do that, and then, God prompts you to do something. You don't just sit home and just are stagnant reading your Bible passively, right? But some people can think that. So those are kind of negative or maladaptive coping skills. Just really quickly, some positive coping skills, which I'm sure you guys already are familiar with this, but we already talked about some of this. One thing is not isolating. You want to find a trusted friend, loved one who can really support and understand you. You also want to, like I said, get a therapist in there. Never hurts to get a counselor, therapist. A lot of people are offering a lot of free and low cost counseling services. Keila, I emailed you a list of multiple clinics in the area, as well as some nationwide.
I'm going to print those. I'm going to post those for you.
Yep. So that's actually really good to do. People who have pre-existing mental health issues, keep those appointments with your mental health providers. It's very important. Grief support groups. Hospice has tons and tons of grief support groups that are free. That was something else that I also sent to you as resources. Hundreds. I think the list that I sent you literally had 100 different clinics that offer grief support, just grief support counseling alone. Seeing your primary care doctor, eating properly, exercising, meditation, investing in your spiritual health. A lot of studies have found that a lot of patients were not doing so well because their doctors weren't really integrating kind of some of their spiritual beliefs. Not that the doctor was preaching to them, but doctors who encourage patients to really integrate some spiritual interventions in their treatment plan, they actually did better. They had better outcomes. So, really kind of investing in your spiritual health is very important. You want to limit screen time. A lot of studies have linked increased screen time to increased anxiety, feelings of loneliness. So definitely be careful with that. You mentioned something earlier, forgiveness. That can be a whole different podcast in and of itself. But forgiveness, really working on any resentments, regrets that you have, because that will complicate the grief process.
Definitely.
And then something practical, which is getting life insurance policy, right? For yourself and your loved ones, because nothing complicates the grief process if you're trying to scramble and get money to bury a loved one, right? So it's important to have life insurance so that you're at least able to bury your loved one.
I like that. I was looking at the comment your aunt made, and she said, remember the good about a person, a recipe they cooked, a song, a fragrance, their strengths. So I have something. When my friend first passed away, a song, well, especially if it was something that we, had together, I could not listen to. It took me a while. And then I remember trying to go on a date, right? This was long after. Well, it wasn't long after, but long enough after. I'll put it like that. And the guy actually wore a cologne that he wore, and girl, I left. The guy, because it struck up so many emotions in me that you don't even really know how you will react to certain things until like you're in a situation. Now, somebody on the outside probably would have been like, "Oh, dude, you dodged a bullet," and he probably did at the time, because I hightailed out of there. Like that smell of that cologne, it did something in my body that just,
it's a trigger.
I folded and I just was like, I'm gone, and I just couldn't do it. But I say all of that to say now those very same things are comforting. So when it first happened, it was not, but I can smell that cologne now, or I could, walk past somebody and then I'll think about like, he used to wear that or whatever. But that came with some time. Like, your body go through some weird things that you don't even know you would experience sometime with grief.
Yep, very important.
Doris has a good question. She said, what are your thoughts on people working from home since the pandemic? Do you think it will have a long-term effect on their mental health? They are so isolated.
Yeah, I mean, I think a lot of that has to do with the type of person you are. I mean, your personality. You have introverts, you have extroverts. Typically they say introverts are energized by time alone. Extroverts are the opposite. And obviously that's not true across the board. But I think if you're working, because there's a lot of good things about working from home, especially with the gas prices, what they are now.
Oh, definitely.
Yes.
I think it depends on who you are. And that's why it's important to kind of know yourself, know your strengths, your weaknesses. So if you're the type of person that you really don't need a lot of stimulation, and you really don't need a lot of outside interference, and you don't do well being around a lot of people, then that person is probably going to be fine. But if you're a person who you need social interaction, and your job is strictly 100% remote, then you really need to be intentional about finding other social spaces and opportunities to really get out there, because it's so easy to sit behind a computer all day. You're working remotely from home, and at the end of the day, you're tired. So you go, you eat, and you're probably in the bed, and you do that long enough, then you probably will be depressed. So I think it's important to know yourself, know the things you like, what you don't like, and then just really be mindful of that. But in general, regardless of your personality type, too much isolation is never good. We are built for community. We're social beings. So that connection with others is vital.
Definitely.
It is.
Because for me, it's weird. I think I'm kind of both. So yes, because I'm definitely extrovert, right?
I think you are more extrovert, but yeah,
more of an yeah. So, but I have been finding that when it's certain crowds or things, I have become an introvert, and I actually get anxiety. So it's kind of weird. I don't even know when all of that started. I don't know. I used to be like, okay, I could go in any room, but it hasn't. That's kind of changed. So when the pandemic happened, I was like, I need to get out this house. I just want to go to TJ Maxx and touch something. I want to go talk to the people in the line. I'm the one that's talking to the people in the line. Like, yeah, so you buying that? Oh, have you ever smelled that candle? I'm that person, right? But some people are not. And then if I find a person that's looking at me like, why are you talking to me? I just turn and talk to the person behind them. So yeah, so I can totally understand that. I wish I could work from home. I've never had a job where I was able to work from home, but that would have been nice to at least experience. So we cover a lot. I think it was a much needed topic. Some people have gained anxiety since the pandemic. For a lot of reasons too.
Ongoing,
for a whole lot of reasons. Like I never stopped wearing my mask even when they lifted the mask mandate. And I would, even though I might wear it down when I was alone, I would pull it up when somebody walked up, and people like, I don't have COVID. I'm like, well, relax. It's not personal.
It's me.
Just relax. Everybody relax, calm down. We all make it out. You know what I'm saying? So is divorce trauma different to treat than trauma from a death? And I'm not the doctor here, but I've experienced both and they felt the same.
Yeah, it's similar brain changes. Like they say this, a lot of studies have found that the same areas in the brain light up when you have relationship trauma, such as, divorce, breakups, as it does when you're actually in physical pain, like intense physical pain. Mm-hmm. So there is a lot of trauma work and help to be had when it comes to broken relationships. I think that that's just an area that's not talked about a lot, because some people are extremely traumatized from the breakup of a relationship, especially if you invested tons of time, energy, you have kids with this person, you envision the life with this and then it just falls
devastating.
Apart. Absolutely.
I think so, because you don't have any control over divorce, over death. If the person doesn't want you anymore, their relationship is just
it's traumatizing.
It's like you have no control.
Yep. Yeah. And I've heard even some people say it's worse than a death, because at least with a death you can bury that person. But what if you run into your ex somewhere?
Yeah, and that's the thing, Iyantta. It is so difficult to grieve a person that is still living. Mm-hmm. So for me, and maybe, there are some people like, well, I wanted the divorce. Even wanting the divorce, this was a person I had been knowing since I had been 13 years old. We had a child together. We had a lot of mutual friends together. Nobody wants to be divorced. Well, I don't think. I'm talking about for the most part of us that got married and had intentions on being married a long time. It's traumatizing, to say the least. I mean, for me, it was a lot, but I can't speak for everybody else.
Yeah, no, if it's, if you have broken heart syndrome that's taking people out of here, then of course, I mean, divorce is very similar to just literally losing a loved one. And I myself went through a broken engagement in 2020. 2020 was a crazy year.
Oh, sorry.
Reasons. But yeah, it was heartbreaking. It was devastating. I mean, it's like all of a sudden you're with this person and then the relationship is over.
Right.
You have to grieve the loss of the future you thought you were going to have with this person.
That part.
The loss of who you thought this person was. Mm-hmm. There's so many layers to that. And I actually struggled with depression, which is part of the reason that got me into psychiatry, but that's a whole nother story. But I really had to be mindful of the state of my mental health going through that, in addition to everything else that was going on in the world. But no, relationship trauma is huge. It's real. And I think more people should get support for it, because I think that the trauma is minimized in many communities.
It is, because that too, rejection. I mean, being rejected is right up there with suffering loss from divorce, or death, because it causes you to look at yourself.
Yeah, and feel
yourself through like a mirror of someone else, and you're wondering like, what's wrong with me? Why can't you? What am I doing wrong?
Yeah, it kind of take you off your own pedestal a little bit. You know what I'm saying? But I don't like to abruptly end, because we want to make sure we post it to Instagram and we have to be done under 60 minutes. But I would like for Iyantta to do some closing statements, take about a minute to do that, and then Tanya to give a challenge, because we've been so off that we haven't been given any challenges. So Iyantta, do you have any last minute statements?
No, but I wanted to kind of, somebody wrote in the chat, I know this is a serious conversation, but Bernie Sanders wrote, I experienced trauma when Kentucky Fried Chicken got rid of the strawberry parfait. Well, that can happen. Those things can happen.
Google it and get the recipe and have your wife.
Yeah, because it's very easy to make.
Yeah. Erica hook you up.
I never knew they had one of those. But no, I mean, trauma. I guess I would say in closing, grief can come in so many different forms and from, situations that you may not think should even cause grief. Mm-hmm. That really, if your body and your emotions are telling you that this is difficult, listen to it. Mm-hmm. Even if you feel like nobody else reacts to it in this way, take it seriously and get support. Mental health providers went through years of training because they really most of them anyways, have a heart to really help you, utilize that resource.
Can I just jump in too? And this is probably make everyone listening do I need a therapist or not? You have one, don't you, Dr. Howell?
Oh, absolutely.
Okay.
Absolutely.
Therapist, you need a therapist, right?
Go
ahead.
Well, if the doctor, I guess that's your point, Tanya. If the doctor say she needs one, then we all need one. She have all the textbook information there is. So I think, Tanya, that was your point.
That was my point. If she needs one, then we definitely need one. But go on, Iyantta.
No, I second that. Absolutely.
So, Tanya, what's the challenge for
I think the challenge is what Iyantta said. Face our feelings, deal with our grief. Hopefully, sometime today or maybe tomorrow, we should put those stages in there so you can determine where you are and what you need to move through to make your life smoother so that you could get to the next level. We don't want anyone to be on autopilot or just coasting, because you just end up standing there. You're like on a hamster's wheel. You're on a treadmill running with nowhere to go. So you definitely have to make sure that you put it out there and don't limit why you grieve. We've talked about that. It could be because of a job loss, divorce, even boyfriend, girlfriend dumped you or broke up. Or maybe it was mutual and you're still, feel bad about it. You need to grieve that. Don't let anyone tell you what you can and cannot grieve. That's up to you.
I like that. So that's the challenge. And Iyantta, we want to let you know how grateful and thankful we are for having you on the show with all your knowledge and information. It helped me a lot.
Thank you for the opportunity.
I appreciate you coming on and being thorough. I'm gonna tell y'all, when we have these, and this is not to knock any guests, because we absolutely love all our guests. But what I love mostly is the guests who, man, when their emails are detailed, because Tanya, you know how detailed I am. Oh, she was so thorough. I'm like, okay. Look, she left no room for me to have to text her. So I appreciated that, right? Yes. She had all her bullet points, but I really, really appreciate that. But thank you for coming on, and I hope that we helped a lot of people. I'm gonna post all of the notes that she sent me for you guys to reach out for resources, and Dr. Iyantta is on Facebook. She is on Instagram. Now I don't know if you inbox her, don't be inboxing her no deep, intricate questions and think it's all for free and stuff. No, I'm just kidding. But what I'm saying,
Vern wants to know if she may take his insurance. So
unfortunately, I'm not accepting new patients. I'm actually trying to get out of. It's a long story, but right now I'm not accepting patients. However, I sent Keila a long list of folks who are, so yes.
And I'm going to post those for you guys too. So we want you all to have an awesome week. Next week.
Oh, shoot. Wait. Can you also too, because if Keila posts all those therapists, can you, if you get time, or just tell Keila what questions, because therapists need to be interviewed too before you just jump in, because it just says doctor, that don't mean that's the one you want to go to. Black man, who that's mine. Black woman, who no, I think you should still question them too. So if you could just add some questions on for them to ask a therapist.
Okay. I'll do that.
Okay, she'll send it too. So, and Iyantta, don't hang up for our 2-minute debrief. And you guys, we want you to have an awesome week and take the challenge.
Yes.
All right. Yes. Have a good one, guys.
Bye. Be safe.
Bye.